Hello, Jaguar Jones. My name is Ebony Dawson. I'm your student nurse and I've come in to assess you. Before we begin, I'm going to check your order to confirm that we are doing a normal saline, wet to dry dressing change to hip every 4 hours. I will now check the hospital policy and gather my tools and equipment. I will now perform hand hygiene. I'm now going to use two identifiers to identify that you're my patient by using your name and your medical record number. Mr. Jones, I'm also going to let you know again that we are doing a wet to dry dressing change and you are allergic to penicillin. I will now going to go perform hand hygiene, but before I begin, I'm going to close your curtain for some privacy. I am now going to begin hand hygiene. Before I start, I'm going to assess my hands for any cuts, abrasions, and I'm going to check my cuticles. I will now turn on my water to warm and run them under there. I will now get 3 to 5 milliliters of hand soap and begin washing my hands. You should wash your hands with warm water and soap when your hands are visibly soiled and when dealing with a patient with C. diff, which is Clostridium difficile, to prevent the spread from patient to patient or from patient to nurse. You should wash your hands with antiseptic hand soap when your hands are not visibly soiled and when you would like to reduce the amount of microbes that are on your hands. I will now reposition my trash can to where I need it and perform hand hygiene. I will now raise the patient's bed to a great working level for me, lower the side rail, and position the patient comfortably. I will now put on my gloves and my goggles. I will now expose the patient's suture wound and the wound dressing while maintaining privacy for the patient. I will remove the dressing away from the patient and I will now assess the drainage. I will assess the type of drainage, the amount of drainage, the color and consistency of the drainage, and if there is any odor present. I will now remove the inner layer of the dressing and the stuffing without touching the peri-wound area. I will now palpate the peri-wound area to assess for redness, edema, or if there's any tenderness to the patient. I will now discard the wound dressing while folding the inside of my glove, and now removing the glove using glove to glove technique and skin to skin. I will now open my dressing change tray, opening it away from me. I will remove the sterile field from the container and place it on my tabletop. I will note that there is a 1-inch sterile border surrounding my sterile field. I will now, without touching the edge of this tray, empty the contents onto the sterile field. I will now get my saline and check the expiration date. I will palm the label in my hand and open it with the top facing upward. I will now pour the saline into my container without splashing. And then recap my saline and set it aside. After this, I will put on my sterile gloves. I will now organize the contents onto my sterile field. I will then begin to soak my gauzes into the saline. Now, before cleaning my sterile wound, I am going to assess it. I'm going to assess if the edges are approximate, the size of this suture, and the drainage from the suture. I will now begin to clean my suture from less contaminated to more contaminated. I will grab a gauze. I will wring it out without splashing. Now I will clean the inside of the suture with one stroke and then throwing it away. I will grab another and then clean one part of the outside. And then one more. To clean the other side of the suture. I will now take a dry gauze and pat dry the suture line. I will now grab another gauze, wring it out without splashing, unfold it, and then fluff it up. I will stuff this gauze into the wound without touching the outside peri-wound area. I will grab another gauze to do the exact same thing. Now that the wound is loosely packed, I will place a dry gauze on the top of the wound for the inner layer, and then I will grab my ABD pad with the blue line facing upward and lay it over the wound itself. I will now remove my sterile gloves, going from glove to glove, skin to skin. I will now tape the dressing down. I will now place a piece of tape in the middle of the dressing. I will label it with my initials, the date, and the time, so that they know who changed the dressing last and when the dressing was last changed. I will now fix the patient to where they're comfortable, lower the patient's bed, and raise the side rail back up. I will now begin to clean up my area. And now I'll perform hand hygiene. Now I will head back to the nurse's station to document my findings. For the suture line, I will document that it is clean, dry, and the edges are approximate. I will document if there were any complications like edema or erythema. I will document the drainage by stating the type of drainage, the amount of drainage, the color and consistency of the drainage, and if there was any odor present. I will also find that I will also document that I found no abnormalities when palpating the peri-wound area for redness, edema, or tenderness to the patient. I will also document that the patient handled the procedure very well and is now good.